Hi, good people. Today we are looking at increased intracranial pressure, and our primary target organ is always the brain, which controls most of the body functions. So, Google defines increased intracranial pressure as a dangerous condition where the pressure builds up inside the skull, and there are various etiologies that might predispose one to this type of condition. So I'll just try to look at the key things. One, you need to know about the normal levels of intracranial pressure, which is 10 to 15. So past 15, that becomes elevated and we are developing this increased intracranial pressure. So what are the possible risk factors? What might predispose one to this type of condition? One, you can talk of infections. Two, we can talk of trauma. Three, we can talk of aneurysm. Four, we can talk of stroke. And five, we can also talk of seizures. In our previous lessons, we talk about convulsions and why we prevent. So if it's not well prevented, it can predispose one to this type of condition. So how will a person present who has increased intracranial pressure? So we are dividing it into three parts. One, we'll talk about the early signs and symptoms, where the person presents with restlessness, altered levels of consciousness, irritability, headache, agitation, sudden vomiting, among others. Then for the late signs and symptoms, we'll have issues with knuckle rigidity. We'll talk of fixed and dilated pupils. We'll talk of Babinski reflex, and finally abnormal posturing. So apart from that, we've but this is warning sign. One, you will present with bradycardia, systolic hypertension, irregular respirations, and at this point, it's something that we call it CUSHING'S triad, which is now more lethal. At this point, we need to do an immediate intervention. So what are the possible interventions that we might do, or the things that we might do to help this type of clients? One, we need to elevate the head of bed. That's around 30 degrees or slightly higher. This helps to reduce these pressures. Two, we need to do stool softness so as to prevent straining, because during straining there is that aspect of increased ICP. Then three, for those patients who are intubated or those who have ET tubes, if we are suctioning, we need not to suction for more than 10 seconds. By doing so, we'll be preventing the ICP from going that high. So what are the medical management? One, we do osmotic diuretics, and to be specific, that is Mannitol. It decreases the ICP. Two, we need to do anti-seizure drugs or anti-seizure prophylaxis, because these seizures will worsen this type of condition. Three, we also give corticosteroids so as to reduce that inflammation of the brain. It says a 28-year-old has been brought to the emergency department after sustaining a closed head injury from a fall. The client is demonstrating signs of Cushing reflex. Based on the nurse understanding of the condition, the nurse knows to look for which of the following signs. So